a quick, painless jab, doesn't take long, quick trip to St George's Hospital. It's been fantastic, doesn't hurt.
One British patient's enthusiastic reaction Tuesday to receiving Pfizer's coronavirus vaccine, certainly a step in the right direction for the United Kingdom. But health officials here in the United States are not expecting such a welcoming reception to the vaccine, particularly in Black communities, where there is already a deep, generational, almost baked-in skepticism of the medical community.
You believe it's going to be a challenge selling this vaccine, the safety of it in the Black community?
It shouldn't be a challenge. It shouldn't be.
Just listen to this exchange with native Harlemite Ruth Williams.
Will you take it?
You know what? I would take it when I see someone else has experienced it. See how their outcome will be.
So you don't believe that it's just safe enough for you to take straight away?
No, I don't.
A lot of studies have already shown very high rates of vaccine hesitancy.
Dr. Olajide Williams, Chief of Staff at Columbia University's Department of Neurology, and no relation to Harlemite Ruth Williams, says increasing acceptance of the vaccine here in New York City will first require undoing decades of mistrust.
The most famous of which is the government-backed Tuskegee syphilis study, in which Black men were actually told that they were getting free medical care, but instead they were denied therapy for their syphilis, and for decades.
Now you have to get to Black communities and brown communities and poor communities where they're suspect about the vaccine in the first place. They don't believe Trump's approval process.
Dr. Williams says obtaining that approval can only begin with a sincere partnership with influencers within the Black community.
Asking community leaders, what would it take for us to increase vaccine uptake in your community, and showing these champions actually receiving the vaccine.
So if there's talk of former Presidents Obama, Bush, and Clinton taking the vaccine publicly, influencers on the national level, then their equivalents on the local level would be religious leaders and community leaders. Those relationships being built now as the pathway for the vaccine to arrive here locally approaches quickly. We're live in Harlem tonight. Jay Dow, Pix 11 News.
All right, Jay, thank you.